Okay, great. So good afternoon, everyone, and thank you for joining us today for this timely and important topic on workforce well-being. My name is Jane Bruby, and I am the team lead for the Care Integration and Workforce team within the Quality Division. On our team, we have Laura Chasso and Montez Legrand-Punter. For those that may not be aware, some of our portfolio topics include behavioral health. So our team supports the behavioral health services care integration technical assistance contract with JSI that provides technical assistance. You've probably seen some of our digest posts on some of the webinars and other types of hands-on technical assistance that we provide, such as one-on-one coaching and virtual site visits. We also partner with HAB and their contract with the National Clinicians Consultation Center regarding the Clinicians Warm Line, as well as other webinars that we provide. We also have a few projects in oral health, and we also have a large project around the Workforce Well-being Initiative, which we will be presenting to you today. Started, I'll kick it over to Tom from JSI for some brief introductions.
Sure, thank you, Jane. My name is Tom Mangione. I'm the project director for this contract. We have actually a staff of about 10 people working on this project, and just to just do a couple of introductions. Ann Keene is our project manager, and Mike Moran is taking charge of the projection sequence here. And during the question and answer period, we may have other staff chime in with answers. Thank you.
Great, thank you. And so what we thought we would do is provide a high-level overview of the initiative and the Health Center Workforce Survey to all of BPHC staff, as this will be a large initiative over the next couple of years. We may have already seen some digest posts regarding the initiative. And so we thought it would be a good idea to provide some information, just so as you see more information going forward, you'll be aware of the project and the different components of the project. And so I'll provide another overview of the initiative, as well as JSI will provide an overview of the Workforce Survey project. We'll talk a bit about the plans for survey administration, and then we'll have some question and answer. And throughout the presentation, go ahead and feel free to type in any questions you may have in the chat box. We hope to get to questions the last 15 minutes of the presentation. We've tried to carve out some time to answer any Q&A. And then any questions that we don't get to, we will get to at a later date after the presentation if we don't get a chance to answer your questions. And so again, the purpose of the Workforce Wellbeing Initiative and the Health Center Workforce Survey is to create a survey that will be administered to all health centers, staff, FTE, to assess the level of workforce well-being, satisfaction, and burnout among our HRSA-funded health centers. And then we will use that data to conduct a research analysis and to provide targeted technical assistance based upon the survey data to health centers, as well as to disseminate evidence-based practices. And really what we hope to get out of the survey is to improve provider and staff well-being and reduce burnout, promote workforce resiliency after a public health emergency, strengthen the healthcare workforce, promote the health center workforce recruitment and retention, and continue to place HRSA as a leader in workforce well-being and the delivery of high quality care. And so currently we are in phase 1 of the initiative. This started in September of 2019 and will go through December of 2021. And in this first phase, we've really initiated efforts to assess the levels of workforce well-being, engagement, and burnout, and identify factors that affect workforce well-being. And this is largely through the actual creation of the survey that will be administered to all of the health centers. Additionally, we're also going to be facilitating a shared learning experience through a learning collaborative as part of this first phase 1. And so here are some of the activities that we have done or will be doing in this first phase 1. JSI is going to go into a more detailed explanation of each of the different types of technical approaches. but we did convene a technical advisory panel who provided insight throughout various phases of the project. We conducted a systematic review of the scientific literature to come up with our survey measures. We've also done listening sessions to try to tweak some of the survey measures, as well as to hear back from our health centers about what's going on regarding workforce well-being. We did create the Health Center Workforce Survey, which we sent out to some of our HRSA partners for feedback into the survey measures. And then we will be doing cognitive testing in May and June to sort of flesh out the wording of the questions, make sure that the questions make sense, any other sort of minor tweaks that we need to do to the survey. Additionally, we'll be doing pilot testing where we'll actually try to administer the survey to some of our health centers in October of 2021. And as I mentioned, we'll be doing a 6-month learning collaborative that will start in March through August. And then finally in phase 2, which will start in September of 2021 through September of 2023, is when we'll actually administer the Health Center Workforce Survey to all of our Health Center FTE. In phase 2, we'll collect and analyze the data and prepare reports, and again, provide targeted technical assistance based upon the survey results and continue to disseminate evidence-based practices. Great, so I'll kick it over to JSI.
Thank you, Jane. As we mentioned, that JSI has the contract to develop the workforce survey. My training is as an organizational psychologist. I started my career doing job satisfaction research. But in addition to us at JSI working on this, we have 2 subcontractors, the Association of Clinicians for the Underserved, who's primarily responsible for the learning collaborative efforts, and then the Center for Survey Research at the University of Massachusetts, who's responsible for the cognitive interviews. My presentation today is going to focus in on the efforts that we have made and are making to develop the survey. So one of the resources that we have available to us in this whole process is a technical advisory panel. It's made up of about 15 members who are national subject matter experts, health center leaders, and some HRSA staff. The role of the technical advisory panel is to provide input and feedback on all the various activities and tasks that we're doing. So feedback on the conceptual model, the listening session discussion questions, the literature review summary, the draft survey, and the interventions that we're using for the learning collaborative. And then at the end, we're going to create a manuscript that they'll give us feedback on. This schematic here shows the stages for the development of the survey. I'm going to talk more fully about each of the boxes, but the first stage is this developing of a framework and conducting an environmental scan that then leads to drafting of the survey, and then testing, and then finally recommendations for implementation. In the environmental scan, one of the first areas was to develop a conceptual model, then conduct the literature review based on that model, and then also conduct listening sessions. We then drafted the survey. We've got feedback from HRSA and the technical advisory panel. We updated the draft. We're now at the stage where we're ready to do testing with as soon as OMB gives approval to go ahead. And then also after the cognitive testing, we'll revise potentially, and again, after OMB approval, do pilot testing. And that will lead then to the final survey instrument and the recommended administration plan. Just to go over quickly some of the efforts, the goal of the literature search was to find evidence that supported both the identification of concepts that were important to predict burnout and job satisfaction, and also to help us select measures of workforce well-being. So we wanted to in reviewing articles that we uncovered in the literature search, we wanted to identify validated measures of burnout and job satisfaction. We also wanted to identify factors that were shown to influence burnout and job satisfaction. One of the concerns initially was to determine whether there are different definitions or wordings of these concepts based on demographic groups. And if so, that would, of course, complicate the development of the survey. And then we also wanted to identify any best practices or innovations in the literature that were shown to reduce burnout or increase job satisfaction. So our first step was to develop this conceptual model to guide mostly the literature search. And it was based on some work that we did initially to look at national studies on the workforce, and then JSI's own extensive experience working with neighborhood health centers, and then my own experience working on job satisfaction studies. After we created the initial conceptual model, we got feedback from the TAP and from HRSA. We made a revision of that model. And what we wanted to do was to use the terms that were in the model to guide the literature search. So I know you can't read the small print inside the boxes, but this was what we came up with. And in the middle box, the workplace factors that were hypothesized or indicated as having influence on job satisfaction and burnout, what we did was an individual search for each of those terms that were studies that were done in the United States within the past 10 years in the healthcare field. And based on that series of searches, we wound up with about 1,300 publications, mostly from peer-reviewed journals, but also from federal reports, the gray literature as it's referred to. But the way we did the search, some articles were identified multiple times because the topics that were researched include multiple topics that were in our conceptual model. So the first thing we did is get rid of duplicates, about 400 duplicate articles. And then we did a quick review of the titles and the abstracts. And, electronic searches are dumb in the sense that, the articles would appear that really were not relevant to our purposes. So we dropped another 400 articles. That left about 500 articles, which underwent a full text review. And we extracted information both in terms of the relationships to burnout and job satisfaction, but also we were identifying the actual measures that were used in those studies. So in terms of a quick overview of the findings, number one, yay, there were validated measures of burnout and job satisfaction. In fact, there were several different alternative measures. We also found support for all of the workforce factors that we had listed in the conceptual model. We did note, however, that the majority of studies were conducted within hospitals or hospital systems rather than health centers. And also a lot of the studies, or most of the studies actually, were focused on clinical staff rather than all employees at health centers. And so in our selection of which measures to use, we tried to, or we did pick measures that were applicable to any employee in the health center. We did find that outcomes varied by staff demographics, but the good news was that the predictors, the measures of the predictors, didn't vary in terms of the wordings, didn't vary, and so therefore we could use the same questions on a concept for everybody. We also did find interventions that were tested a few, but mostly the interventions we found were recommendations for interventions. So a finding that work-life integration affected job satisfaction. The authors of that article would then, in their conclusion or discussion section, make recommendations for the kinds of interventions that might be successful, but they actually hadn't tested those interventions. One of the things that we found, along with in the review, was the Mayo Clinic framework for understanding burnout. And we liked what we read in that article, our articles, and we found that their conception aligned very well with our conceptual model. The major difference is where we had one big box in the center that listed all the workplace factors that might affect job satisfaction and burnout. What the Mayo Clinic framework did is divide those factors into 7 major groups of drivers, is what they called the factors. And we liked those groupings. And what we did is first of all, we integrated their conceptual model with our model. Their 7 groups are the colored headings. And what we did is we used their framework, their organization, to help us organize the questions in the draft survey instrument. We do have a literature review summary report. It's on the JSI website. And in this report, we have the description of methodology. We have the concept definitions for burnout and job satisfaction. We review the available measures, and we give the logic for our recommended measure to use in the workforce study. We also, for each workplace factor, we have the concept definition, evidence that shows the relationship to burnout and or job satisfaction, the available measures that we had, and the recommended measures to choose. We were cognizant in making choices of which measure to use of the overall length of the survey. We didn't want to create a monster. And so when we had a choice, like for instance, the workload measure, we didn't pick the 25-item measure of workload. We picked the 5-item measure of workload. And the other thing that came out of this research was the relevant types of interventions. And in the appendix, all of the measures that we found are listed in the appendix, and also indications of which one we chose. The other part of the environmental scan was to do listening sessions where we talked directly to health center staff. The primary purpose was to make sure that we weren't missing some important issue based on the literature review, and just to hear how health center staff talked about the issues. We had 6 sessions grouped by different occupational groups. We had a medical group, we had a dental pharmacy vision group, a behavioral clinicians group. We had clinical support, non-clinical support, and 1 session with leadership. Our goal was to do about 10 participants for each of the sessions. So our goal was 60. We were a little concerned that because of the busy and heavy workload of people that, okay, we invited 12, we hoped to get at least 10 showing up, but our fear was only 5 or 6 would show up. And we were pleasantly surprised. As you can see, we had a total of 73 staff participating. And one of the things they said was, thank you for letting me be part of this session. I can put a sign on my door, do not disturb, for the next 90 minutes because I'm on this important call with HRSA. So they appreciated the respite from the busy day to talk to us. Each of the sessions lasted about 90 minutes. And And we had questions like, what makes a good day at work? How do leaders in your health center promote job satisfaction and joy? And in your experience, what is the single biggest cause of burnout? Those are the kinds of questions we posed. The discussions were lively. The leadership questions were a little bit different because of their perspective. We did ask them what brings pride and feelings of satisfaction in your job, but then we asked what is contributing to burnout and lack of satisfaction of your staff, and tell us about any initiatives that you've tried that either worked or did not work. So there was important findings that we got from the listening sessions. The biggest and the most important was our literature review did not leave anything out. There was nothing mentioned by anybody in the listening sessions that was completely unknown to us or not captured in the draft survey. However, what we did hear was a sense of priorities and importance of several of the factors. And so that allowed us to then review the survey and in some cases either confirm that we had a reasonable level of measures or actually induced us to increase the number of questions in that area. So communication was important. The relationship of the health center to the community was important. And of course, adequate staff, resources, and training. Things that influence the ability to provide high quality care, both in terms of facilitating care and high quality care, and in terms of things that worked against high quality care. Another area that we actually wound up beefing up is this whole area of recognition and appreciation. What we heard from the staff that it was a very important positive influence on job satisfaction and sort of a counter to burnout, to know that the work that they were doing, both individually and collectively, was recognized and appreciated. So hearing it from coworkers, hearing it from supervisors, hearing it from leadership, but also hearing it from patients and hearing it from the community played a big part. And so one of the issues was to what extent health centers are doing a good job of communicating what they're hearing from these different sources. Also, people talked about performance-based incentives being important to them. Even at, thank goodness, it turned out even in nominal amounts. So some people talked about they were given chocolates for a job well done, and several other people talked about gift certificates from their health center in denominations like $20 and things like that. But also just words of appreciation, being identified as employee of the month or whatever. All of these factors created this very positive aura that insulated them from the negative consequences of things like workload or maybe not earning as high of a salary as they could in other healthcare facilities. Organizational culture was important, and particularly in terms of shared decision-making, having a sense of shared priorities for the mission of the organization. Those were important elements of culture. And there were issues mentioned about discrimination, discrimination by patients or patients' families who didn't like the gender or the race or the age of the clinician. Some younger physicians told us, people said, well, when do I get to see the real doctor, kind of thing. And there was a sense of discrimination or less valued by people saying my profession is not valued. I don't perceive that my profession is as valued as other people here at the health center. So we took all of this information, we drafted the surveys, we got feedback on the surveys, we changed the surveys a little. And now we're at the beginning stages of the survey testing phase. We have submitted to OMB approval to go ahead with the cognitive testing. When we get that, we will start the cognitive testing. And then likewise, after we make any revisions, we also need OMB approval for pilot testing. In terms of the cognitive interviews, again, our goal is to get 60 staff who will fill the questionnaire out online. And then following that, we'll have one-on-one interviews with them, asking for them to speak to questions that were unclear, the need for definitions, the order of the questions. We'll know how long the surveys took because that's something that Qualtrics can tell you. But also we'll ask them their perception of the length of the survey. Is it too long? Is it okay length and such? And we'll make, based on all of that, we will analyze the common themes and make changes, hopefully not dramatic changes or many, but we will certainly respond to those cognitive interview findings. In terms of the pilot testing, again, after we get OMB approval, we will target 300 to 400 health center staff. Just one of the things that we'll look for, or many of the things we'll look for in the responses is, are there questions that a lot of people don't want to answer? Are there questions that seem to give inconsistent types of answers? Or are there questions where everybody's answering the same thing? Obviously, you want to have some variation in responses in order to do correlations with other things. If a variable is constant, the correlation is 0 with anything. We would also get a sense of participation rates. We'll probably ask some extra questions at the end as to what their perceptions are about what might induce their coworkers to participate. And then the primary statistical analysis that we're going to do is to calculate reliabilities of each of the concepts. We'll do calculations with the coefficient alpha. If the reliabilities are lower than what we would expect for an individual concept, it's like, we have 3-item measure of work-life integration. The primary way to increase the reliabilities is to add a couple of more items to beef up the number of questions. And given that we have quite a few waiting in the wings, it'll be easy enough to make that kind of revision. Okay, so I am done with my section. I'm going to turn it over to Pamela Burns to go forward.
Thank you, Tom. And I don't know who's advancing these slides for me, but I'll just say next
Mike.
when I'm
Mike
ready.
is.
Okay, Mike. So we're just going to talk very briefly about the Workforce Wellbeing and Satisfaction Learning Collaborative. We're going to begin this on March 3rd, I believe. It's coming up pretty quickly, running through the middle of August, really a hands-on approach to understanding how to roll this out into the real world in the future for health centers. Next slide, please. So this is, as I said, is to serve as a resource for right now for health centers that are participating in it, but also for informing for future learning collaboratives, refining them off of our experience that we have here, and also hopefully in the end to create continuous ongoing improvement in workforce well-being and satisfaction communities of practice. So we hope to have a long-term outcome from this activity. We're going to have 6 sessions, 6-month learning collaborative with 20 health centers. Applications were sent out to well over 100, a couple hundred probably, health centers, applications that mainly focused on what their experiences were, their interest in being a part of this collaborative, and their ability to commit to participating for the 6-month period. We asked health centers to provide us with 4 to 5 individuals with a minimum of 2 participating in all of the sessions. We came up with a group of 20 that are very distributed across regions, urban, rural, large, small, and we made sure that we included folks that were funded under special populations as well to have that input. The sessions are set up so that there are a combination of didactic and group. The way it'll work is we have a group of 6 subject matter experts who each in their individual areas, which I'll talk about in a minute, will lead a didactic session about that particular driver of workforce satisfaction. And then in the following session, we'll have groups, 4 of them, because we have 100 people. So we have 4 different coaches, if you will, who will have facilitate group meetings. So folks can talk about how it went for them, what they tried to do based on that topic, and then reporting back. We're also going to have a discussion board and an ongoing ability for folks who are participating in the collaborative to be able to interact with each other, and ongoing support with the coaches who are also doing the facilitation of the group meetings. We'll be evaluating how it goes so that we can make those refinements and ensure that it's a real value added for all our future participants. And also, this whole thing was informed from the literature review findings and the input from the TAP. Next slide, please. So again, the faculty will be leading 6 topics. The topics are the ones that were gleaned from the literature review, the listening sessions, and from talking with our TAP members to really focus in on what they felt was important. Also, the people who are doing the didactic sessions, the input for who to select was certainly provided by the TAP, as well as our respective experiences with different people around. I do want to back up for 1 second because I meant to start by making sure to give a shout out to Sabrina Eddington from the ACU, who has played a huge role in pulling this together and making sure that we're going to be successful by the end of it. So I just did want to mention Sabrina because she's been so important. So a change package was developed, IDing the areas of focus. Again, as I said, with TAP input, the literature review, and the listening sessions. And each of these areas has interventions, as Tom mentioned when he was speaking. So we'll have a didactic session. The participant health centers will select 1, 2, how many they feel they can handle interventions within that driver. And then 2 weeks later, we'll come back and we'll talk about how that went, what the barriers were, and what worked and what didn't. And we'll continue to do that in a rotating way throughout. So we hope that we have that opportunity to really hear from the health centers, not only what is working, but how it works best to be able to do the implementation. Next, please. The learning collaborative process is based on best practices. Again, from JSI and ACU's extensive experience with running learning collaboratives, as well as from the TAP members' experiences and literature and resources that we've all reviewed in order to make sure that we're approaching running the collaboratives in a way that really maximizes their positive impact. And as I said, we will provide coaching as we go through and assessing the value and progress of how we're doing. Next slide, please. Okay, well, that's it for me for the learning collaborative. So I'll wrap up the JSI piece here with just giving you a visual of what's coming next. As Tom said, on the survey development, it's going to continue to run through the cognitive interviews, pilot testing, and then on to the final implementation administration of the survey. The other activities in phase 1, the Workforce Well-being and Satisfaction Learning Collaborative, as I said, beginning the first week of March and winding up in the middle of August with our wrap-up session, and also starting to prepare this spring with the draft of the final manuscript for publication in a peer-reviewed journal. Jane, I believe it's you.
Yep, great, thank you. And so to close out, we'll briefly touch on phase 2 of the Health Center Workforce Survey Initiative, which will primarily focus on the administration of the survey. And so our anticipated administration date of the survey will be August of 2022 to October of 2022. And yes, that is 2022 and not 2021. I'm sure you heard Tom mention several layers of OMB approval that we have to go through for the cognitive testing, the pilot testing. And then once we have that final package in December of 2021, it'll be about a 6 to 8 month review period by OMB. And then once we actually release the survey to the health centers, we're expecting about a 2-month period for survey completion. And again, we're hoping to get all health center FTEs. So again, likely it will probably take about 2 months to get those survey responses back from all of the health centers. And then again, we'll use that data to establish our baseline levels of job satisfaction and burnout, conduct research comparisons at the national, state, and organizational levels, identify areas of organizational change to improve workforce well-being, as well as to inform our technical assistance strategies going forward. And of course, to continue to disseminate our evidence-based practices. Next slide, please. So again, if you have any questions, please feel free to add any of your questions in the chat room right now. That would be great.
So Jane, hi, I have one question. I also wanted to let folks know if they're more comfortable asking a question, if they raise their hand, we can also unmute their mic and they can ask directly. But let me go ahead and do this first question. I wanted to know if any of the speakers could address any aha moments observed during the process. So I'll open it up to both JSI and Jane if you want to speak to aha moments.
Well, one of the ones was in the listening sessions, the eagerness of people to participate, both in terms of when we solicited who would like to participate. Even though we were only looking for 60 people, we had almost 200 people raise their hand and say, "Oh, yeah, I want to participate." And I'm sure some of it was perhaps influenced by the $100 incentive that we were giving people, but mostly I think it was because they were very interested in talking about their jobs, which and trying to contribute to improving the workplace situation. So I think that augurs well for the receptivity to the survey when we eventually roll it out. I don't know, others have any aha moments?
Pamela or Sabrina or Jane?
I would also add, so we had posted in the digest for participants in the Learning Collaborative, that 6-month Learning Collaborative, and we got an overwhelming response for that as well. And so I think that just speaks again to like what Tom was saying as far as the demand for people to want to talk about workforce well-being, you know, even though they already overwhelmed with work related to COVID. So, and ironically, this initiative, as you noticed, started before COVID. So it sort of is falling at a good time in terms of assessing burnout and resiliency.
Anybody else? Pamela, Sabrina?
I mean, I would only echo what Tom was saying, that listening sessions were really amazing. People were more than willing to talk. They brought up a ton of stuff and they really interacted with each other, which I thought it was not only that they got the time away, but they seemed to be learning from each other as they went along. Oh, we tried that at our health center, or maybe we'll try that. That's a good idea. So all along we've been kind of we're doing what health centers do, getting more bang for the buck out of all the activities at the same time.
This is Sabrina. I would just add, one of the things that surprised me, it was a pleasant surprise, was to see the team makeups. So for the teams they generally asked for 5 people to participate, and it ranged all the way from interns to scribes to CMOs, CEOs. There's just a huge range of folks who are on the team, and I really appreciated seeing that staff from, you know, reception all the way up to the C-suite were all participating. So it'll be interesting to see what kind of discussions they have together.
Yeah, that should be great.
And I'll add, I don't know if this is an aha moment, but I guess a confirmation moment when we did the research around moral distress. As Tom mentioned, most of the research was done in hospitals and health system settings, including ICUs and NICUs. And so their moral distress was actually more around trying to overtreat and do more that they knew would not really help the patient in the long run. And we wondered if that moral distress could relate to what primary care providers feel in terms of, especially in community health centers, trying to address social determinants of health or social related health needs. And indeed, in talking with the TAP and others, we found, and the listening sessions, that was true. So our questions around moral distress were not around ICU care, but more around not being able to always provide all the needs of the patients when those were based upon those social determinants of health. So I thought that was a real good confirmation and very targeted and right on for community health center providers and staff, all staff. So there's no other questions in the chat. Again, I encourage questions, or if you want to raise your hand, Mike and Leanna can see your hand raised and they can unmute you to ask a question in live. So if you're more comfortable speaking your question, please raise your hand. Wait a few moments.
Perhaps we were quite thorough with that presentation.
Perhaps.
Pretty much everything.
Or all the listeners are very shy. And
Yes.
How about if we ask the question back to the attendees? Were there any aha moments or, wow, I didn't expect that when we were going through the presentation or the findings, perhaps? Oh, okay, so Larry, you're unmuted, so you can go ahead.
Appreciate it, thank you. I just think it's pretty, it's very telling that the research that you uncovered, that there was not a lot of, health center work done previously. So this is breaking ground. And just wanted to definitely highlight, it's interesting that the work that you've done, once you had those listening sessions, that it validated a lot of the information that that you had put together. I do think the recognition piece is something that continues to, I think in all workforces, we've got to make sure that we spend the time to look after our folks. And so it's great to hear that popped up as one of the pieces included in the survey.
Good point.
yeah, one of the sort of most telling interactions or moments in one of the listening sessions was somebody really talking about how one day, I think it was a Vietnamese restaurant, brought lunch for the whole health center as an appreciation for the work that they were doing during the pandemic for their community, kind of thing. And it really struck the staff and the people at the health center that, oh, we are appreciated for what we do. And so that was an interesting point.
Okay. Nothing in chat, but anyone else want to raise their hand or send in chat? It's fine too.
Well, if we don't get any questions now, you see my name is up here on the slide. So if anybody has any questions that they want to pose to me, whether it's about workforce well-being or some of our work that we do in behavioral health, I mentioned at the start of the presentation that we do have a behavioral health team that oversees the rollout of the behavioral health contract with JSI. So any questions related to that, workforce well-being or oral health, my name is up there. So please feel free to send me an email, call me, IM me, however is best for you. And additionally, we will be posting the recording in the upcoming weeks. So if you want to share with your colleagues that you enjoyed the presentation and recommend that others listen to it, that will be coming out in about 2 weeks once we have the recording available. So with that, thank you.
You, Larry.
Yes. Appreciate that.
Yeah, so then I guess with that, unless GSI has any closing words, we'll say thank you all for your interest. And as I mentioned, this will be an important initiative over the next few years. So you will continue to see information in the Insider and in the Digest about workforce well-being and the rollout of the survey, which won't be for a little while, but the summer of 2022 will be here before we know it. So thank you all very much for joining us.
Yeah, thanks. Tom, did you want to have it say any final words? Good. Okay. All right, great. Well, thank you very much. So with that, we will close out.
Great, thank you.
Bye.
Bye.
Bye.